I am Peter.
And I'm Paul.
Welcome to the Twin Perspective.
Today, we're going to be talking about a lot of things, and it's mostly about men's health.
Mhm.
So, in the United States, men live an average of about 76.5 years, while women live about 81.4 years. That's a gap of nearly 5 years. Paul, I'm going to ask you a question. When was the last time you went to a doctor's office?
Define when.
So, when was the last time you packed your bag, booked an appointment, and said, you know what, I'm going for a checkup?
Um, okay. I think the last time was when I had to do some work medicals, just to, be able to do that. Yeah.
Okay. So more like you were forced to do it, but it was not like an intentional thing, right?
You're putting me on the spot now. Well, I would say an average thing, on the common saying that if I hold responsibility on that. If you don't feel a responsibility to do something, or if there's no
Yeah.
need to do something, you don't have that need to actually go to the hospital. You know what I mean? But I do try to do at least some appointments sometimes.
Okay. Because seriously, research has shown that men are less likely to see a doctor, and research continuously shows that men do not seek preventative care like women do. Do you get what I'm saying?
Yeah.
So this is one of the myths or facts today that we're trying to unravel, to see like, is this really true? Why don't we like going to the doctor's office or do women go more? So is that based on genetics? Is that based on race? Is that based on cultural backgrounds or ethnicity? What really is the problem here?
We're trying to man up. I, I, I,
Trying to man up?
I think the word is manning up because sometimes when we feel there's something going on with us, we
Hmm.
feel, especially acting like, we don't want to show that we're broken down. We're like, okay, I'm gonna
Gotcha.
sleep it off, Oh,
Hmm.
there's something on my body. Okay, don't worry, I'll just try to do something. So we do that first self-care for ourselves to feel we can take care of the incident going on with us before we actually get to the hospital. I think the hospital for men is like the last stop.
So I know that I'm going to take this back, even at the hospital, right? When I've like seen patients come in and the spouse is always like, he said it was coming to he wanted to come to the ED, you know, and for him to say that, I believe there's something going on because on a normal day, it wouldn't come here. So it feels like we wait till that final stop or the final point where we think like, oh my God, okay, now I can't handle this anymore. Let's go check, By that point, things are already bad, right?
So I was just thinking and how, we as men were so quick to drive 45 minutes, an hour to book an appointment to get our engine checked, get an oil change, based on recommendation. Oh, who fixes your car? This person fixes my car. And we drive all the way there just to get that checked. But we find it hard to book a doctor's appointment just to get ourselves checked.
Hmm. So now that you're going into the analogy using
Yeah.
cars or automobile, I'm going to say this. Imagine not having a mechanic or going for an oil change for your car for about a year or two. I
Mm,
feel like that's how a lot of people treat their bodies sometimes. And we do know that we need to get an oil change in our cars, right? A tune-up.
true.
So now imagine, so let's treat our bodies as a car, you know.
But if you're saying that, Peter, if you're saying that, because if I go get an oil change, for example, it's still that
Yeah.
after 5,000 kilometers or something, you need to come in for an oil change or you need to come in for a
Hmm.
service. So
Hmm.
how does this apply to humans? Like when we go to, what's the routine check like for us?
So I'm gonna say this on the average, saying that you do not have like other comorbidities that are like, underlining stuff that you have to go
Yeah.
to your provider's office all the time. People do like, 6 to a year checkup, that's fine. At least a yearly checkup, right? And if we're using our mileage for check doing the oil change,
Yeah.
For men, I kind of feel like we put a lot of mileage on ourselves emotionally, you know, even like physically, there's so much we put on ourselves. So at the point that you get into that, don't break down first before you feel like you need an oil change.
So you mentioned something about the underlying conditions that you might have, and I think one of the things that we actually go through is um, let's say cardiovascular diseases, which high blood pressure is one of them for us.
Correct.
And we've seen also that men have 80% higher risk of cardiovascular diseases than women.
Correct.
80%. So my thinking is, are we, is this because, we smoke a lot, well, men smoke a lot or drink? Is this the lifestyle that, is giving that differentiation between men and women and how long we live?
Firstly, preventative care has been seen to help a lot of things before it actually gets to a point of no return,
Hmm.
right? In terms of smoking a lot, I do not know exactly what the ratio is in terms of if men smoke a lot or, who smokes a lot. However, one thing I do know is that only about 3 in 5 men get an annual physical, right? Based on research. And nearly 40% of men only seek medical care when they think something is seriously wrong.
Mm,
So that shows us that, let's say you're smoking or you have other life conditions, like, you do not exercise, or you have underlying conditions, like, let's say, the silent killer, like high blood pressure and stuff like that, and
yeah.
you do not know, and you don't even check it. We both know that when you have stuff like that, it silently damages your organs, right? So by the time you pass out, while walking, or
Hmm.
something happens, then you rush to the emergency room. Then, like, oh my
After you
God,
realize that, oh, this has been creeping on. Mm,
correct. But if you go and you getting those checks, and it's got early, you could be put on medications. There could be lifestyle modifications that could help you, you know, even if all of it is not reversible,
mm.
but it could still be maintained, and you do not go to that part where you're deteriorating in a part that you cannot come back anymore.
Okay. You mentioned something about the physical when you have where you go to the to do your diagnostic exams, right? I
Correct.
think one of the things that people begin to realize is what are those things that is it that the procedures are scary to do a yearly physical? Like, do we have scary procedures? Like, why are we scared of going? Are they gonna do something that is, that's gonna scare us? What are those things that would be randomly done for physical yearly?
Okay. So I'll say this right now. So growing up in different sexes, right, you realize that for the female, while they're growing up, they're used to, at the young age, getting the talk of, oh, menstruation, you get blood coming out of your body, your breasts are getting bigger. There's that knowledge and that self-awareness of how their body is. On the other part, we do not get that education. I think the education you get is more sex, use a condom, oh, I know you're a month to one, those are more like the talks for guys,
Yeah.
right? Not like the body changes, because I don't really think we have like a lot of body changes like that, except for, like, testosterone and all that other things, like, going on. However, the awareness of that is, so the female are more comfortable with people like touching them, because they're going for, like, oh, they don't want to they do the pap smear, they do colonoscopy, they go through
Birth.
childbearing, like they,
Yeah.
so like they're used to people touching them. Do you get what I'm saying?
Mhm.
They're used to that. Oh, put on a gown, and man, we do not have those. We do have them, but we do not go through that initially. And I'll say this: I know that and I know you're going to say, what am I talking about? When I was doing one of my practicals thing we're doing, we had to do a rectal examination
Yeah.
on guys, uh, to see. For some people, it's uncomfortable, especially men, like
Thinking
somebody
about it
touching
feels
them.
uncomfortable. That's what I'm saying. Just thinking
Yeah.
about it feels uncomfortable. Okay.
It
So
exactly.
what are those? I feel this contributes to the fears that we have as men to say, oh, if I go there, is someone gonna, do a rectal exam for me? Must I do a rectal exam?
So we have to go away from the cultural beliefs or the norm that, oh, you know, testicular cancer is real,
Yeah,
colon cancer is real.
true.
Women, while they're taking their showers, are examining their breasts to see if they have lumps or stuff like that. How many men actually touch their testicles to see if there's something else growing over there? Or even do breast self-examination, because men have breast cancers also. You know, this is
Hmm,
not awareness we do have, or maybe the awareness we do have, but it's not what is practiced.
hmm. Got you. Got you. So I think rightly thinking about the mindset we have as men, things,
Hmm.
oh, we shouldn't do this. It's not a manly thing to do, or it shouldn't be done to us as men. I think that's a very
Hmm.
key fact to look into that because we can keep talking about cholesterol, keep talking about so many things affecting men, but there's one topic I want to actually also move us into, if that's okay, with you. And this is the
Tell
part
me,
that we don't talk about. And I know you really like this because this is one of the things you talk to me about. So let's
what
shift
is
gears
it?
a bit. This is about talking about the mental health of men.
You got me on that one. So
Yeah.
now think about this, right? You do not want to go to your provider or your doctor's office or for a checkup just for things about your body, ignoring signs of headaches, fatigue, shortness of breath, chest discomfort, weight loss, like, oh, it's normal. I'll just take Papa Tylenol or something like that. But the whole thing now starts from here.
Hmm.
If you're not sane to even have that level head, to think clearly, you can even want to do all these things because depression has set in,
Hmm.
and signs of depression is you even not wanting to do anything. This is part of the signs of it. But I'm so happy right now because I feel like, and I was talking to a friend of mine, we see a lot of women's health clinic everywhere. But how many men's clinic do we see around? Very few of those, you know? And now we've also understood the fact that going with the days when, well, I'll say this, probably as a Nigerian, when people tell you that, oh, I'm not going to be at work today, I'm going to see my therapist.
Yeah.
And you're like, oh shit, she's crazy, you know,
Yeah. Yeah.
because it was just that understanding of if you're
Yeah.
seeing a therapist, oh my God,
Something wrong with you. Yeah. Yeah.
something's wrong with you. But
We, we,
that's not it.
yeah, which brings us, to how the data, for example, in the UK now, which we've seen that, for example, we have that statistics to show that
Mhm.
out of three men, or out of four people, three men commit suicide. Does that make sense to you? Because
Hmm.
around three-quarters of all the suicides in the UK are associated to men.
Um, Paul, that is sad. That is sad. I just feel like there's a lot of burden that people carry,
Hmm.
you know, and no one knows how we feel, you know, and the fact that you feel like you could do it by yourself, there's no one to talk to, you know, it keeps getting like it's a build. Then it gets to a point people just feel like they can't do no more, you
Yeah.
know.
So I 100% agree with you, and I think the society sometimes doesn't help us because if as men we begin to say some things, the common phrases we hear, someone saying, "Oh, don't be too dramatic," it's fine. You're not the first person who has gone through that before, or just sort yourself out, you're a man, or just man up, on this. These are things that has been done, and I remember that there was this thing, I think it was Bupa that did like a survey to be able to get all
Mhm.
this data on what's going on with men and what those dramatic changes that people talk about. So I think it's quite a challenge to see that happening.
So I'm gonna say this right now, and this is to like everyone listening right now. There's a part, right, for beliefs, Christianity, and there's a part for mental health. I think a lot of people are mixing that up right now,
Mm,
thinking because I'm a Christian, I believe in God, I do not need mental health. There's a thin line between it.
mm.
And I just want people to understand that. Like you having that great connection with God, you having him to talk to, sometimes you still need to get some things processed.
Hmm.
And I tell people, like someone was asking me, like, when is the best? Do you cry? I said, yeah, when I pray to God, sometimes I cry because you need an outlet. That's what I'm just trying to say. Everyone needs an outlet to just speak without being judged, speak without someone thinking you're crazy, so you could process things out in your own mind space.
But if you look at the escape that people actually have with this, because you don't have such outlets, just like you said, to give put this out.
Correct.
And the escape or the trap behind this is either you begin to fall into, because you've bottled so many things up, you're trying to find an escape. And the escape is either you begin to go into drugs, you can begin to,
Mhm.
drink, or you want to overwork yourself, to say, once I'm working, it distracts me from actually facing reality of what's going on. I had a talk with someone last week and I said that the I said sometimes I got to a stage that I felt reality was more scary
Uh-huh.
and I wanted to sleep more because if I sleep, I was escaping what was going on. I don't have to think about it. But once I wake
Mm.
up, I feel like, oh, I'm back to this. So I want to go back to
Correct.
sleep. That's a bad
Correct.
place to be in this
It
space,
is.
headspace.
And you can't really run away from it.
Mm.
The truth about the matter is it's always going to be there. It's like going on vacation, right? And thinking, oh, I'm on vacation. You're still going to get that ding on your phone saying your bills are due. You can't run away from those bills. you
Yeah,
know,
you have to come back to
Even
it.
if you're on vacation or nothing, those like the daily issues, the daily problems, the daily bills, the month,
Yeah,
they'll find you. I just
absolutely.
don't I like they find you wherever you are.
Absolutely. So now talking about that, I think for men having that, you know, openness with people.
Correct.
I had a talk with one of my friend last week. We haven't spoken in a while, and we touched things we've never, ever, ever spoken of before. And saying that thing to someone you trust that, hey, I've not been all right lately. Like, can you tell someone like I don't like telling people how are you anymore because I just feel it's the regular feedback. How are you? I'm good. How are you? Good. How are you? Telling someone like I've not been feeling right lately. Like, you know, can you open up? Can you find that small community or that person where you can tell I've not been feeling right lately?
So I'll say that a lot of, and I'm speaking from like, being a man and just seeing how life is,
Yeah.
we've been hurt a lot by being vulnerable
Well,
to
I'm not.
people.
This is this is not a grand confession. I'm not. I'm not saying go and confess. To people. But go ahead.
Yeah. And that's why I feel like a professional help is always better
Mm,
because you're not being judged. Humans will be humans. I've seen where friends are so close to each other and they use each other as like an outlet, to let things go. And later on, there's whatever happens. And all those deep conversations,
mm,
they're being used against you,
mm.
but you were just being vulnerable.
Yeah.
But if it's a professional, outlet for you, that way you know that there's that
Being judged.
patient,
Mm-hmm.
and wherever confidentiality that
Neutrality. Yeah.
whatever you're saying is just in that place. So use friends as outlet, but also we got to realize that there's something, well, I'm just speaking for myself. There's some things I don't want to be vulnerable about with my friends,
Mm-hmm.
you know, and I'd rather have someone that wouldn't judge me. And
Mm-hmm.
some people are so fortunate and so blessed that they have friends that are more than friends and
Yeah.
would take their secret and
Mm.
vulnerable to the grave.
Yeah.
You know,
Yeah.
if you have people like that, that's fine. but I just tell you now, the world is hard. Okay, people are people.
Mm.
So yeah.
Yeah. Well, just for anyone listening, I feel that if you have something on your chest, something you feel heavy about, with what Peter said, I think this is the right time for you to find, that professional or that doctor or, that friend you have and open up. If it's something medical, I think we have this thing with humans or with men. You're taking a stroll, for example, and all of a sudden you just feel lightheaded, like you want to actually collapse. It has never happened to you before, but we just shake it up. We're like, oh yeah, I'm fine now. We don't feel like, do I need to get this checked out? I haven't felt this way before. We're like, okay, and you get to have the same feeling, but after a few minutes of chilling, you feel much better. You just let it go. Do we at that point need to seek care rather than just wait till we fall and we can get up again?
Do I feel attacked right now, Paul? Why
Because
do I feel
you've told me
attacked right now?
before.
I feel so attacked. Listen, sometimes I'm like, you know, I'm just dehydrated. I'll just drink some water and just,
Mm,
keep it moving. And that's what we're saying. Like, the body is such a beautiful thing that it shows you signs,
yeah,
you know, but we block it out, you
yeah,
know. You see those little signs of, I wasn't like this yesterday.
yeah,
Old age is different. When you age and we know some things are deteriorating, that's
mm,
different. But signs of that fatigue, oh, my chest is comfort right here, or I almost fell when I got out of bed yesterday, stuff like that. And if you keep ignoring it, it's hard. And I'm not coming for anyone because I just feel like I'm also, you know, even as a medical professional, I fall into that category of like, oh, it's really nothing. So we got to do more, we got to do more
I do agree.
as,
Agree.
yeah, we got to do more as men.
I do agree. I feel that men need to realize and take it on themselves that it's not a sin or it's not wrong to ask for help. Like
Ah,
it's a thing we need to give ourselves permission to do. Asking for help is not something that is wrong. And I remember my conversation last week. I realized that when I was talking to my mate, what happened was the conversation we had, I realized I was not the only one even going through some things that we spoke about. Sometimes we think we're the only one in that problem because everyone comes in looking all bright, and good, but we don't realize someone is going through something. But by the time we begin to have conversations and open up, we realize that we can actually learn more and actually we might not even be in the bad state we think we are, and talking to someone can actually quickly bring us out of that hole.
correct,
So what I just want
correct.
to say plainly here is if anyone, if you're going through anything, your dark moment or, that tunnel where you feel like where's the light, or you're thinking of, I don't want to be here, I feel overwhelmed, please reach out to someone. Reach out to, I think most countries have a crisis line now, or if they have a doctor, or you have a very good friend you want to talk to, ask and you're allowed to need help as a man. Go ahead,
I
Peter.
like that, Paul. And there's this phrase that I've seen, I want the t-shirt. It says, it's okay not to be okay.
Mm,
You know,
mm.
it is okay, and we could cry. You could be vulnerable. You could let it go as a man, So yeah,
On a,
I totally agree with you, Paul.
on a lighter note, so I had a I had a bad tooth ache.
Mhm.
I think about a year ago. Oh my goodness. I could not man up. I think toothache does you can man up toothache. Like I don't know if you've if you've experienced it before. I remember the kids came in and I was trying to, I'm like, please leave. I told them to leave because I wanted to cry. But I didn't want to make them see me cry. And my daughter was trying to, and man, I started crying, man. I was like, even my wife saw me crying. I'm like, oh my goodness, I can't man this up. No, this is not. So don't let's get to that stage where you can man up anymore and everything just goes into pieces for you. So I think that's been great. But one, well, thing I want to talk about, again, talking about this old men health and stuff like that, is if we look at the industry right now, and this is the industry of like the wellness industry, because lots of things are coming up on wellness, wellness industry. Use this some supplements as a man. This would help your testosterone. This app is good. What do you think about that generally, about this wellness industry?
I'll say that at this point, and it's 2026, there's been so much research, there's been so much quality improvement on health and overall wellness. I still do know that in the past days, our parents, not parents, because we're still younger, like our grandparents and
Hmm.
older,
Hmm.
they were not taking all the supplements and it
Yeah.
was more natural stuff and they still had a good life, you know. What I tell people is this, and I'm going to use my mom for example. She likes medications a lot. She wants to take all the supplements. I want vitamin C, I want vitamin D, I want zinc, I want this, you know, as preventative. And I'm like, did they tell you at work doing your that your magnesium is low or something that you need to take? Because for me, and that's how I think in my head, you know, regular supplements are good, but overdoing it also is,
Mm,
could be a lot. So if you do know you need supplements, I always say check with your provider also. Like let
yeah.
your providers know what you take. You ask people like, do you take medications? And they say no, because in their head, all they're thinking about is like, prescribed medications. So I usually ask again, what over-the-counter medications do you take? Because
Mm,
sometimes you never know what that's also doing in the system. So looking at everything in totality also helps. So yeah, mine is if it works for you and you think that's it's making you healthy. And some people it's just more of a placebo
psychological.
effect.
Hmm.
Or yeah, like if they don't take maybe a wellness pill today
They're not okay.
and they feel dizzy, they're like,
They're
oh
like,
my God,
oh,
because I didn't take my pill today. It
well,
might be
yeah. But
yeah, so
my concern with that industry, especially, with all the supplements, which, no shade to anyone, because I think it works for other people too, is I
mhm,
feel that all the things that even as men we can do not to even get to the stage of having to begin to use those medications or those, um,
correct.
you know, whatever they call it. But for example, the simplest thing I would say is having good sleep. Okay, because the sleeping is very vital because that's where you can get so many things repaired. That's where you can get all those supplements you've utilized. You can get them back and things like that. But we don't have enough sleep as men. And I fall into this category that I feel I want to work so hard, and I feel sleeping is being lazy. If you're sleeping, you're a lazy man. You should get up. Men shouldn't sleep for that long. Get up and work. That mindset.
So I'll say that sleeping is not luxury, right? But
Mm,
sometimes it could be seen as luxury in terms
mm.
of how
You feel I'm throwing
and
shades
this
at you again.
yeah, because in my head I'm processing this, right? And I feel like, try I would have said try living in America and say, if sleeping is luxury or not,
Mm,
when you have a lot of bills you're trying to pay, right? You have two jobs you're trying to handle, you know, or you're a full-time student and you still got school, you still got work, also a full-time, job. So I'm just saying, like, it's hard, and that's the way we've been accustomed to like use our body, but we forget the fact that it's wear and tear, you know
exactly.
in as
Exactly.
much as we want to get all these things done, want to get all these things together, if you overuse it now and later in the future, what happens to you? This lady was just sharing with me the other day, and it made me think a lot. And she was like, my dad passed away
Um,
just right a year before retirement. And I'm like, oh my God, all this money in your 401k, all this extra savings you've done, to say, I want to enjoy it while I
mhm,
retire, but
mhm.
you working yourself so hard. Were you even going to be like, will you leave? enough to
Yeah,
enjoy that retirement if you don't take care of your body before that time,
absolutely. Absolutely. Yeah.
So that's the scary part. And she said, Peter, she said, I leave my life. She said, at this point, I could say I've done it all. And I'm like, damn, like I can't even, I, like for you to say I've done it all, like you've
You feel
accomplished
that accomplished.
everything you've said you want to do, you
Yeah.
know. But sometimes we're just so far chasing a lot, and we, ignore what's within.
I agree. And part of what I was saying about the, all the supplements we're using, which I don't go against, but I feel the basic things we should try to do, even if we're using them, we shouldn't see them as something that, oh, because I'm using a supplement, I shouldn't do the right thing for myself. The supplement
Correct.
is already working for me. You know what I mean? So
Correct.
in terms of the sleep, I think sleep is still good. I feel we should also have a bit of movement. If sometimes if I see the escalator and I know I'm not done anymore, I prefer to use the stairs sometimes, just
Hmm.
those little things. Don't make it too strenuous, but make it constant. Okay. I feel that food is another big thing, on what we feed ourselves. What are we eating? How are we eating them? All this less ultra processed foods and stuff like that we should try to consume. Then the last one, which I do love, is having a connection. Have a connection with someone, friendship. Don't be, when you're alone. What's that thing they always tell us when we're kids? That an idle mind is a devil's workshop. Don't be idle because once you keep to yourself, all you're thinking about is all those things you shouldn't think about. You begin to put your mind and your mental state in the wrong place. So have the right connection with people. I think that's really key. Peter, what do you think?
I totally agree with that. Especially like connection.
Mhm.
You know, when people are sick, sometimes they tend to get better faster when they have people caring for them, feeling
Yeah.
like they're loved. You know, so there's healing in connection.
Mm.
You heal faster. With connection. The only thing also I know that well, I could be um, a victim sometimes of just eating. Like I try to cook or meal prep, but sometimes when life gets busy, you want to just grab the fastest thing around you. So it's you making those conscious effort to do better, you know. And then there's no judgment here. We all work in progress,
Sure.
and we're all trying to get better.
Likewise, absolutely.
Yeah.
Well, if we're trying to put this to a conclusion, I think, Peter, I'm gonna ask you because what's one homework, not 10 homework, just one homework you would like us as men to do after listening to this podcast? What do you think we should do as men? Just one thing.
Listen to your body. I just
Mm.
say that. Listen to your body. If your body coughs, sneezes, or something's wrong, it's okay to pick up that phone and call your provider's office or walk to the emergency room. Don't wait until it's too late.
Well, I think that concludes it. I think that the thing about this is just having that. And really, I've taken some things too. I know because I'm also guilty of some of these things. But yeah, let's do better for ourselves as men. And hopefully, we'll all be good.
All right, Paul.
All right, thanks.